If you're doing CrossFit, the chances are you know somebody whose shoulder hurts. Today I'm going to teach you the 3 biggest reasons why people who do CrossFit experience shoulder pain and what you can do about it so that you don't have to miss your WODs. There are 3, count them 3, major reasons why people experience shoulder pain from my experience in a CrossFit gym more than they do in other places. Reason number 1 is that there is no eccentric phase or very little eccentric phase. We'll talk about what that means later on. Reason number 2 is that the range of motion is so complete and the speed at which you're doing things is so great that oftentimes people run into the ends of their ranges of motion for the joint and it's not as much as you need to do the exercise and have a good rep. And number 3 is that there's so much downward pulling like this and so little upward pulling like this. And so there's a disbalance. I don't know if disbalance is a word. Maybe it's misbalance or the muscles are imbalanced. There's not balance. You understand where I'm going with that. Between your strength pulling down and your strength pulling up. And that actually plays a huge factor. We're gonna get into what all 3 mean for you in the gym today and what you can do to start to reverse them. I'm Dr. Sean Pastuch, founder of Active Life, and since 2005, I've been a personal trainer and a chiropractor, helping people get out of pain without going to the doctor or giving up the gym, including my 3 CrossFit gyms that I used to own. Everything I'm gonna teach you today has been tested and proven in the real world with real people, so you can trust that it's going to work for you. When you're lifting weights, there are 2 main phases of the movement. There's the eccentric phase and the concentric phase. The eccentric phase is when we're lifting the weight. So if you're doing a bicep curl, this is the concentric phase, and that's the eccentric phase. By the way, not bad, right? The concentric phase is when we're shortening the muscle. The eccentric phase is when we're lengthening the muscle under tension. Now, in CrossFit, we don't have a lot of the eccentric phase, and that's important, and I'm going to discuss with you why. When we are doing our exercises, our tendons respond most to the eccentric phase of contraction. They're like pressure sensors. That's what they are. They don't grow the way that a muscle grows. They don't have blood supply the way that a muscle has blood supply. They don't have nerve supply the way that a muscle has nerve supply. So they are counting on pressure across their entire length to reorganize themselves after they break down. What do I mean by break down? Picture your tendons like a rope. We want the fibers of the rope to be aligned like this so that they can pull with a lot of tensile force. If they start to get haphazard like this, the rope is going to get knotty and it's actually going to break down over time and be less effective. When that's your tendon, that hurts and it can become inflamed. This is what happens when we do a lot of without any control. It's not assured you're going to end up with tendon pain as a CrossFit athlete. Not at all. But if you're experiencing tendon pain, this could be one of the reasons why you're having it. So let's say, for example, that you're someone who's been lucky so far and you don't have any tendon pain, especially not in your shoulder. You want to give yourself a buffer so that you don't end up having it in the future.
That'd be nice.
So what I want you all to do, whether you are an avid CrossFitter training 5 days a week, 6 days a week, the 3 on, 1 off, 3 on, 1 off, whatever, or you're somebody who's only going to CrossFit 2 to 3 days a week. I want you to take at least 1 day a week, skip the WOD, and do a bodybuilding workout that includes tempo. Tempo. I know tempo is a little bit of a curse word in the CrossFit world because we don't have much of it inside of the affiliate. It's not the king, it's not the queen, it might not even be the jester, but it's important to your tendons that you get at least 1 day a week of it. If you're doing CrossFit 2 to 3 days a week, you don't have to skip one of those days to do your bodybuilding workout. You just need to make sure that you have one. This is a day that you're dedicating to tendon rehabilitation, tendon durability, tendon resiliency. Call it whatever you want. I don't really care what you call it. But you need 1 day a week when the focus is your tendon, not your work capacity across broad time and modal domains. I said a bodybuilding workout because we're going to be doing things isolated. I don't actually care if you get a great pump that day, but you will, by the way. What we want to do is focus on a 3-0-3-0 tempo. If you're not sure what a 3-0-3-0 tempo means, it's okay. You're not doing one in a CrossFit gym, and so I'm going to teach it to you. This is what tempo would look like in a gym. Back in the office, I told you we're going to use a 3-0-3-0 tempo. 3, the first 3, represents the concentric phase, when you're moving the weight. The first 0 represents if there's a pause or not at the top of the movement. The second 3 is the eccentric phase, while you're lowering the weight, lengthening contractions. And then the last 0, the fourth number, is if there's a pause or not at the bottom. So let me walk you through what it would look like to do a 3-0-3-0 tempo on a high pull. You're going to count to 3 on the way up, you're going to pause for 0 at the top, count for 3 on the way down, pause for 0 at the bottom. Here we go. 1, 2, 3, 1, 2, 3. 1, 2, 3, 1, 2, 3. Here's another exercise with a 3-0-3-0 tempo where you can really start to see and feel the contrast because of how you would typically do it in a gym, especially something like a CrossFit gym, a shoulder press. 1, 2, 3, 1, 2, 3. 1, 2, 3, 1, 2, 3. That's your 3-0-3-0 tempo. Let me show you what shoulder presses without a tempo at all might look like. No tempo in those. The weights you do those exercises for should feel heavy. It doesn't mean they are heavy. It means they should feel heavy. I want you to think 7 out of 10 RPE. What that means is maybe 20% more of the number of reps that you did, you could do on top of your set. So I want you to focus on 60 to 90 seconds of continuous movement like I was just showing you. 60 to 90 seconds will be difficult if you choose a weight that you could only do for 90 to 110 seconds. That's how I want you to focus. You'll find that getting to a weight that's appropriate for that in the exercises that you're training, because there's going to be a bunch of different exercises for you to train, will require some trial and error. That's fine. You're not going to nail it on the first day, but you're going to start making progress towards doing it on the first day. Now that advice was for people who are not in pain today, but maybe you are. So what do you do if your shoulders are already hurting? You're like, what's my deal? What do I get?
And what do I get?
Well, you win a different prize. It's called HSR, Heavy Slow Resistance Training. HSR is a different kind of tempo training for your tendons that is more brutal and requires more time and requires more frequency than what I just described before, because now we're talking about a tendon that's likely damaged. Before I even get into how to do it, it's important that I make clear this is not medical advice. I'm not prescribing this to you. I'm saying that we've used this at Active Life to help hundreds of people overcome tendon pain when it was clear that doing this would not cause them harm. So if you're not sure this would cause you harm or not, go back and watch the video that I created on pain so that you can make some determinations for yourself about whether this is making you better or making you worse. Do not just go into your gym, grab weights, and start doing what I'm about to describe. It could be problematic. I've used this with a lot of CrossFit athletes, a lot. And some names that you definitely know if you're a CrossFitter, like Rich Froning, and others, many others. I already did a full video that explained how to use HSR in a program design. You can click on it here and go watch it, but I'm going to break it down for you really quickly here, not as detailed as I did over there. HSR is as simple as a slower eccentric than concentric for a rep scheme that goes from 15 reps in week 1 all the way down to 6 reps by the end. And what it's doing is you're having 2 to 3 exposures per week where the weight should feel like an 8 out of 10 RPE or to tolerance for discomfort. And the range of motion that you're working through is as full as you possibly can. Let's get into the second problem. The range of motion under intensity could be problematic for you. Am I saying you don't have the range of motion, so you're not allowed to do that exercise? No, I'm not. What I'm saying is if you don't have the range of motion necessary to do an exercise, and you try to do the exercise anyway, and you add speed and intensity to that exercise, it could cause you some problems. It could cause you problems at the joint where you're having the limitations, and it could cause you problems at the joints that end up compensating as a result of you not having the range of motion where you needed to do the exercises. This is especially true when it comes to the shoulders. Oftentimes what we see is people don't have the range of motion in their shoulders, and so they grab some from their back. They end up with back pain or neck pain instead of shoulder pain. And they never realized that they had a shoulder problem because when they go talk to their coaches or their doctors or their physical therapists or whoever, they only talk about the neck and the back pain. And then what gets addressed is the neck and the back pain when all along it was a shoulder problem. Let's talk about it. I remember one specific time I got brought into a gym, a CrossFit gym, to do an evaluation of all of their members before a class. The idea was I was going to show them a different way to do the same workout so that they could understand they were not getting hurt in their gym as a result of what their gym was doing, but as a result of the way that they were failing to modify exercises properly in the gym. Now, some of that does fall onto the coaches because they don't know how to do that. But in fairness to them, it's not something that they're taught by CrossFit HQ. They don't assess people, and they're not looking for range of motion limitations. So you, the member of the gym, need to be able to identify them for yourselves. If you ask a CrossFit affiliate owner or a CrossFit coach as a general rule, they're going to tell you that they can assess you while you train. They see movement impairments and then they scale you back, or they change the exercise. What I'm here to tell you is that that's oftentimes too late. You have to be responsible for it yourself before you go in. That's why you're paying $150 to $250 a month and not $1,500 to $2,000. The most common exercise I see people doing in a CrossFit gym that they haven't earned the range of motion to be able to do is pull-ups. The second most common is probably things like push presses and jerks overhead. Now, there's a really simple test to see if you have the necessary range of motion to do that. Watch.
This is shoulder flexion. Keeping your palms facing your body and your elbow locked out. You're gonna bring your arm overhead. From here, we're going to let it fall comfortably overhead. We're looking to see that the elbow stays locked out and the blade of the hand makes contact with the floor. Bring that back down. We'll test each arm independently and back down. And then we will test both arms together. We're also looking to see that there is no gap created in the lower back.
I hope you just tried that. If you didn't try it, go back. I'll be here. Try that test.
We'll be right back.
If you came up short on that test and you're getting pain in your upper back, in between your shoulder blades, in your neck, or in your shoulder when you do things like pull-ups, push press, jerks, the reason could be because you're lacking the range of motion in your shoulder, and you're going to want to pay attention about what to do to solve for that. If you're lacking the flexibility, I want you to be doing one of two different things depending on your skill set and your interests. One is I want you to get a band and hang it from the pull-up bar so that you can go do your pull-ups down at the bottom but never actually finish with your arms in front of your head. Let me show you what that would look like. When you're doing a pull-up, if there's no band, you're gonna end up here. There's no choice but to end up here because that's hanging underneath the bar. But if you have your feet in a band, you can lean back a little bit and now you're not having to go all the way to the top. You can end up right about here, which is probably short of the range of motion that you're limited in your shoulders. So the band from the pull-up bar is option one. Option number two, if you don't have the strength to do kipping pull-ups or even strict pull-ups anyway, go to ring rows, and you can adjust the rings to a height that allows you to simulate a pull-up more than just laying flat on your back and pulling. By the way, ring rows are really hard if you do them properly. Really hard. For the group who's extra flexy, I want you doing strict pull-ups. Strict pull-ups. I want you to do strict pull-ups. So put the band on the pull-up bar and control the full range of motion. When you get to the bottom, make sure that you're still active. We don't want to let our shoulder blades go up like this. We want to be at the bottom, still holding ourselves in a solid position. That's what you need to be working on. Now, if you think banded pull-ups are for wimps, I have news for you. I prescribe banded pull-ups to almost every CrossFit Games athlete and CrossFit Games champion I ever worked with. Jacob Heppner, for those of you who have been around a long time, was doing banded pull-ups the year that he took top 6, I think it was. Maybe it was 6th, 5th, I don't remember, at the CrossFit Games. And he made a post talking about one of the workouts I gave him being the hardest thing he's ever done. And he was a CrossFit pull-up guy. But we had him doing it on a band for strict sets of 35 to 40 reps, and it just blew him out. He couldn't believe it. And it gave him all the durability that he needed in his shoulders so that he could do the exercises that he needed to do outside of pull-ups without pain. Let's get to the third problem. CrossFit has a reward system for your ability to do the exercises that they deem to be important. You're gonna get faster times in your workouts if you get good at pull-ups. You just are. You're gonna get better times in your workouts if you get strong in the places that CrossFit typically programs. CrossFit typically programs pulling down and not pulling up. In fact, in the CrossFit level 1, there's something called the sumo deadlift high pull, which I don't think is the greatest exercise, but it's better than it gets credit for, and it's utilized less than it should. What happens is we do hundreds of pull-ups a week in a CrossFit gym. I said we, I haven't been in a CrossFit gym in years, but CrossFitters, you do more pull-ups in a week than maybe anything else except for squats or hinges. What happens as a result of that is we get really strong doing this. The only thing that we do overhead or pulling in this direction is a press. Now you might be thinking, what about all my cleans? Don't those count? No, because when you're doing a clean, you're only really getting to about here and then you're moving underneath the bar. So we're lacking the ability to pull in a vertical direction. And I've seen CrossFit athletes at the most elite level and at the most novice level find this imbalance so severely that when we start to fix it, problems disappear almost immediately. Here's the one exercise that we prescribed more often than almost anything else to the most elite CrossFitters in the world and got them the most bang for their buck in terms of time doing the exercises and relief from their pain. This exercise is called a one-arm high pull. So we're gonna go ahead and pick up our kettlebell or dumbbell, whatever it is that you're using. And then from here, all we're going to do is leading with our elbow towards the ceiling, raise the weight towards our collarbone. So I want you to think about this like you're zipping your coat. Bring the weight up faster and down slower. Let's talk about how much of that you should be able to do. Take 1/3 of your body weight and however many strict pull-ups you can do. Let's say that you weigh 150 pounds and you can do 10 strict pull-ups, or 250 pounds and you can do 10 strict pull-ups. And you're gonna do the high pulls. Same tempo. Faster up, slower down, no pause at the top, no pause at the bottom. Most of you aren't gonna be close. Not even close. I'll give you a story about this. When Sam Briggs came to work with us at Active Life back in 2017, I think it was, whatever year was, I believe, the last year in Carson, California at the CrossFit Games. The opening workout for the open was overhead walking lunges and pull-ups? I don't know. It was the first time I had you moving around in the gym. Anyway, Sam had severe neck pain and shoulder pain, and she was able to do like 25 pull-ups, somewhere around there. Don't quote me on the exact number. But she was unable to do a single high pull at 1/3 of her body weight. In fact, I believe, and I can't take the credit for this one, it was actually my partner who was working with her at the time. Credit goes to him. If he was here, I'd pat him on the back, but I haven't seen him in a while, so there's no back to pat for me. But I believe she was able to do like 25 pounds for a high pull for a set of 6 to 8, something like that. Now she weighed closer to 150 than she did to 75 pounds. So only being able to do 25 pounds on the high pull is way too little. She needed to be able to build that up significantly so she'd be able to have the durability she needed to train the way that she trains and win the way that she wins. Good news, she took 4th that year at the CrossFit Games. 4th, and didn't have the neck and shoulder pain that she came to us with. At least not all of it. So now you're gonna try higher pulls. And the first thing you're gonna say is, it hurts. Knees don't feel good. Because you're not good at them. You're weak.
You're weak.
You don't have the range of motion. Are you hurt or are you injured? All that stuff. Remember, if you're not sure if you're supposed to be doing this, go back to our video about pain. As long as it's less than a 5 out of 10 on a scale of 10 for pain, and it's getting better or staying the same from rep to rep, you're gonna be okay doing the high pulls, as long as you're doing them properly. Don't listen to the whiny physical therapist or the orthopedic surgeon who think that a high pull is the same as Hawkins-Kennedy test, which is a test where we bring our arm out like this and then rotate to see if you have shoulder impingement. Totally different when the arm is here than when the arm is here. It's not comparable. So to those of you out there who are like, high pulls are gonna impinge your shoulder. No, they're not. They're not. They're not. You don't have to stop doing pull-ups while you're working on your high pull strength if your issue is that you're able to do so many more pull-ups than you're able to do high pulls. What you're going to want to do though is start to change the stimulus that you're driving into your shoulders for the pull-ups. You're no longer going to be doing things like weighted pull-ups or max intensity sets. You're going to be looking for way more stamina sets and much more motor control. You're going to be fine-tuning your skill. You're not looking to build strength, to build an even bigger imbalance and deficit in your upward pulling as compared to your downward pulling. I know you don't think you're good enough at pull-ups yet, and you're not. You suck. Just kidding. You don't suck, but you feel like you suck because you're around a lot of people who, in the bubble that you're in, are excellent at the exercise. Compare them to the people outside of the gym. Compare them to yourself before you came. Not them. Compare you to yourself before you came. You're very good at this exercise by comparison, just not as good as the bubble that you're in and you're chasing. So in the meantime, you're going to focus on the skill and the stamina. And at the same time, you're going to build the strength in your ability to do the high pull. Now look, none of the stuff I taught you today is meant to help you qualify for the CrossFit Games. That's not what this is for. It is meant to allow you to do your next WOD. If you're a CrossFitter and you have shoulder pain, it's likely because of one of three reasons. 1, you're not minding the eccentric at all. It's just go, 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 baby. 2, you lack the range of motion necessary to move through the ranges of motion that you have to do to perform a good rep in the gym. And so your joints are slamming into the end of their ranges every time you do a workout. And then other joints are compensating to let you look like you're doing the right thing. But now you know how to test it. 3, you are so good at pulling down and so bad at pulling up that it's embarrassing. I'm not embarrassed. You're embarrassed. No one's actually embarrassed. It's not embarrassing. I don't know why I said that. I know why I said that, because it is. It's not. You know. You get it. I'm not making fun of you. You're going to reverse these problems with simple interventions. For the tendon stuff, that's the fast moving, you're going to add HSR or bodybuilding protocols for your tendons. The link for that instruction is in the show notes below. For those of you with range of motion issues, too much or too little, you're going to work in the ranges of motion that you have while trying to either increase them if you're too limited, or build strength and skill in the end range of them if you have too much. For those of you who are really good at pulling down and not so good at pulling up, you're going to get better at pulling up. That's fairly commonsensical. 1/3 of your body weight for a high pull on a single arm for the same number of reps that you can do pull-ups. That's your goal. I promise you get there and you have shoulder pain as a result of not being able to do that, you're going to see your shoulder pain start to go away. Now look, if you got this far in the video and you're like, what do I don't understand. I want to hire you to coach me. You can. I'll charge you a boatload of money, or I'll refer you to somebody who will charge you a reasonable amount of money and do a great job. All you got to do is write a comment below that you're looking for help. But you can do all of this for free. You can start by yourself doing all of this for free with the information provided in this video. I'm Dr. Sean Pastuch, reminding you that pain is a choice and you can live more, hurt less. This video is over. Like and subscribe. Now the video is over.